Okay, let's picture this. You're prepping for surgery. The big one, maybe. You've done all the things right. Picked the top surgeon, the best hospital.
Got the lucky socks packed.
Exactly. Said your goodbyes, mentally prepared. But what if, and this sounds kind of nuts, what if the most critical prep costs less than your morning coffee and has zero to do with the actual operation?
It's strange, isn't it? Because surgery, any surgery really, it carries risk. Serious complications even. Well, the worst outcomes.
And what we've been digging into suggests this one simple thing can just slash those risks, improve your chances massively, and it costs like pennies.
We're talking about checking and, crucially, correcting your vitamin D levels.
Right, and this isn't just, good advice for patients. The evidence is so strong, it feels like something every single doctor and nurse should be thinking about.
It sounds almost too simple, though. Why this little vitamin? Why is it so critical when your body's about to face, essentially, major trauma?
Well, that's the first kicker, isn't it? The surgery itself is the thing that tanks your vitamin D.
It's an immediate hit. The stress of the operation makes your body just burn through its existing vitamin D. We saw this really striking example.
Yeah.
Average levels before surgery, maybe around 42.7, something like that. Pretty decent.
Yep.
Immediately after the operation, plummeted down to an average of 28.
Whoa. So you go from sufficient to deficient like that?
Instantly. It's not a slow decline, it's a crash. And that deficiency happening right when you need your body to recover, that's where the trouble starts.
Okay, so let's unpack that trouble. What happens when your D levels crash right before recovery?
Well, first off, your immune system's back door is basically left wide open.
How so?
Vitamin D is key for controlling something called antimicrobial peptides. Think of them as your body's own little microbe killers, natural antibiotics, sort of.
Okay.
If you have enough vitamin D, your body's ability to crank these things out can increase, get this, by up to 4,000%.
4,000? Seriously? That's huge.
It's massive. That's the kind of firepower you want when you've got surgical wounds trying to heal. And it explains why having good D levels cuts infection complications, like sepsis, way down.
So overall complications cut roughly in half? Is that what the study suggests?
Pretty much, yeah. A really significant reduction across the board.
Okay, so infection is one major area. What else goes wrong when D levels are low post-op?
The heart and your blood pressure, that's another huge area of risk after surgery.
Right, your cardiovascular system is under immense stress. How does vitamin D play into that?
It's linked to nitric oxide production. Nitric oxide is what tells your arteries to relax, to widen, vasodilation.
Ah, okay. Helps keep blood flowing smoothly.
Exactly. But if you're deficient in vitamin D, that signal gets weaker, your arteries can constrict more easily.
And blood pressure shoots up, which is the last thing you need.
Precisely. A dangerous situation during or right after surgery. There was this one study focused on open heart surgery patients.
Okay, high-risk stuff.
Very. And they found that making sure patients had sufficient vitamin D before the operation cut the risk of developing atrial fibrillation AFib afterwards by as much as half.
Cut AFib risk in half. That's incredible. That's a really common and dangerous complication.
It really is. Shows you how fundamental this is.
So beyond infections and heart issues, what about just basic healing? Closing the wound, repairing tissue.
Yeah, I mean, that's crucial too, isn't it? And low D makes the whole process messier, slower.
Messier how?
Inflammation. If you go into surgery low on vitamin D, your post-operative inflammatory markers, the things doctors measure to see how much stress your body is under those, can spike by around 200% more than someone with good levels.
200%, so like triple the inflammation.
Effectively, yeah. And that intense, prolonged inflammation is counterproductive. It actually fights against healing. Wounds take longer to close, recovery drags on.
Makes sense. And this isn't just skin deep, right? We saw stuff about bone healing too.
Absolutely. Multiple studies link good vitamin D levels to better outcomes after surgery for things like osteoporosis or even just general bone repair like fusions. It helps rebuild the structure.
And there's another structural thing too. The fall risk, especially for older people.
Oh yeah, that's a big one. Low vitamin D weakens muscles. Combine that with being groggy and weak after surgery.
Recipe for disaster.
Totally. Your risk of falling goes way up. And a fall leading to a fracture right after you've had major surgery, that's a devastating setback. Sufficient D helps shore up those muscles.
Okay, this next connection is the one that honestly kind of blew my mind. The link between vitamin D stress and your brain.
Ah, yes, the adrenal glands. This is where it gets really interesting.
Because surgery is like the ultimate stress test for your adrenals, right?
Absolutely. They're dumping hormones like adrenaline and cortisol just to keep everything running during that trauma. That's partly why heart rate and blood pressure are monitored so closely.
So what's the vitamin D connection?
The adrenals really do not like going through that massive stress without enough vitamin D. They need it to function properly, to regulate that stress response.
And if they don't have enough D?
They kind of overreact. That cortisol spike you normally see after surgery, if you're low in vitamin D, it can be up to 4 times higher.
4 times the cortisol? That sounds bad.
It is. That huge, sustained stress hormone bath hinders healing, messes with inflammation regulation, and we're starting to see why vitamin D influences something like 2,000 genes.
Wow.
And maybe 200 of those are directly related to how the adrenal system works.
That intense stress response probably explains the brain fog too, right? That post-surgical cognitive fuzziness people talk about.
There's a terrifying statistic on that. If you go into surgery low in vitamin D, you are 8 times more likely to experience post-surgical cognitive dysfunction.
8 times. Okay, that's
Yeah.
That's alarming. That takes it from, oh, I might feel a bit fuzzy, to a really significant risk.
Exactly. It highlights how system-wide the effects are. We even saw mentions of it helping with organ transplants, reducing rejection risk.
Right, and fewer complications for patients on ventilators, too.
Yeah, it's not just about bones or mood. It seems to be a critical modulator for your body's response to severe stress and trauma.
Okay, so we're convinced need vitamin D. But now we have to talk about how much. Because the levels needed before surgery aren't your typical daily dose, are they?
Not even close. We're not talking about maintenance here, like taking a little 1,000 or 2,000 IU pill every day.
Right.
Before surgery, the goal is different. It's saturation, getting your levels up fast so your cells have plenty available when the trauma hits.
And the protocol is usually loading up for a few days beforehand.
Typically, yeah. Around 3 days seems common in the research, gives the vitamin D time to get into the cells and switch on those protective genes.
Okay, brace yourselves, because the doses used in some of these studies are kind of nuts compared to what we normally hear.
They are definitely eye-opening. We're talking international units, IUs. Forget a couple thousand. Some studies use single loading doses of 100,000, 200,000, even 300,000 IUs.
300,000 IUs. In one go or over those few days?
Often as loading doses in the days just before. And remember that AFib study, the open heart surgery one?
Yeah, the one that cut the risk in half?
They used 600,000 IUs of D3.
600,000. Wow.
And it gets even more intense. Research in pediatric intensive care units. Kids getting 10,000 IUs per kilogram of body weight.
Per kilo. Not just 10,000 total.
Per kilogram. That shows the level of aggressive saturation they felt was needed in critical situations.
Okay, the immediate reaction hearing those numbers is probably, whoa, isn't that toxic? Isn't that dangerous? We hear all these warnings about vitamin D toxicity.
And that's a totally valid concern, right? You hear 600,000 IUs and you think hypercalcemia, kidney stones.
Yeah, am I going to cause a different problem trying to solve one?
But the key thing here is the duration. It's critically important. We are only talking about these super high doses for a very short window. Maybe 3 days before, maybe a dose right after.
So it's not a long-term plan. It's a short, sharp, preemptive strike.
Exactly. It's strategic fortification. The goal is just to ensure your cells aren't running on empty during the peak trauma. The risk of toxicity from a short burst like that seems to be extremely low, especially compared to the risks of going into surgery deficient.
And the potential payoff is huge, right? Fewer complications, maybe fewer days stuck in the hospital, faster healing overall.
A massive potential return on investment for something so simple and inexpensive.
It really is kind of a profound example, isn't it? How sometimes a basic nutritional building block can have a bigger impact than really complex medical tech.
It's all about creating the best possible internal environment for your body to handle the stress and repair itself. Foundational health.
So, wrapping this up for everyone listening, what's the takeaway? Before you schedule that surgery, whether it's big or small, cancer, thyroid, bones, whatever.
Get your vitamin D level checked. It's a simple blood test.
And if it's low, talk to your doctor. Seriously, talk to them about a short-term, high-dose loading protocol in those few days right before the procedure.
Think of it as arming your body's defenses before the battle.
It's like we spend weeks, maybe months, researching surgeons, checking hospital ratings, figuring out insurance nightmares. But how often do we check if our body's own internal special forces have the ammo they need?
Good analogy.
If getting your vitamin D right could be the difference between sailing through recovery and having 8 times the risk of serious brain fog, why on earth aren't we treating this like the single most critical pre-op check there is? Makes you wonder, doesn't it?